A chest X-ray is an imaging test that uses X-rays to look at the structures and organs in your chest. Certain diseases can cause changes in the structure of the heart or lungs. Chest X-rays can show the size, shape, and location of the following: heart, lungs, bronchi, aorta, pulmonary arteries, middle chest area, mediastinum, bones of your chest. Chest X-ray if it is suspected that you have any of the following: enlarged heart, which can mean you have a congenital heart defect or cardiomyopathy. Fluid in the space between your lungs and your chest wall, pleural effusion. Pneumonia or another lung problem. Ballooning of the aorta or another great blood vessel, aneurysm. Broken bone. Hardening of a heart valve or aorta, calcification. Tumors or cancer. Diaphragm that has moved out of place, hernia. Inflammation of the lining of the lung, pleuritis. Fluid in the lungs, pulmonary edema, which can mean you have congestive heart failure. A chest X-ray can reveal many things inside your body, including the condition of your lungs. Chest X-rays can detect cancer, infection or air collecting in the space around a lung, which can cause the lung to collapse. They can also show ongoing lung conditions, such as emphysema or cystic fibrosis, as well as complications related to these conditions. Heart-related lung problems. Chest X-rays can show changes or problems in your lungs that stem from heart problems. For instance, fluid in your lungs can be a result of congestive heart failure. The size and outline of your heart. Changes in the size and shape of your heart may indicate heart failure, fluid around the heart or heart valve problems. Blood vessels. Because the outlines of the large vessels near your heart, the aorta and pulmonary arteries and veins, are visible on X-rays, they may reveal aortic aneurysms, other blood vessel problems or congenital heart disease. Calcium deposits. Chest X-rays can detect the presence of calcium in your heart or blood vessels. Its presence may indicate fats and other substances in your vessels, damage to your heart valves, coronary arteries, heart muscle or the protective sac that surrounds the heart. Calcified nodules in your lungs are most often from an old, resolved infection. Fractures. Rib or spine fractures or other problems with bone may be seen on a chest X-ray. Postoperative changes. Chest X-rays are useful for monitoring your recovery after you've had surgery in your chest, such as on your heart, lungs or esophagus. Your doctor can look at any lines or tubes that were placed during surgery to check for air leaks and areas of fluid or air buildup. A pacemaker, defibrillator or catheter. Pacemakers and defibrillators have wires attached to your heart to help control your heart rate and rhythm. Catheters are small tubes used to deliver medications or for dialysis. A chest X-ray usually is taken after placement of such medical devices to make sure everything is positioned correctly.